Good morning, friends. Myself, Dr. P. Samuel, Assistant Professor, Department of Biotechnology, Bishop Eber College, Trichy. In this video tutorial, we will be going to discuss about food allergy causes and treatment. In my previous video lecture, we were discussed about what is food poisoning, right? Food poisoning is caused by bacteria or fungi or even some viruses. Sometimes protozoa may also be reported. Additionally, there is another concept called food intoxication. Intoxication is due to the presence of toxin in the food substance. These toxins are secreted by the organisms growing on the surface of the food material. And this area is totally different, called food allergy. We will discuss it in detail in the upcoming slides. Let's move on to the first slide. So, this is actually an abnormal immune response. So, we can define food allergy as an abnormal immune response to the food protein. When a person with food allergy eats the allergen is found to be the etiologic agent of the food poisoning case, right? Their immune system produces antibodies called immunoglobulin. So, whenever a foreign substance enter into the body, the host immediately produce a protein called immunoglobulin, so called antibodies, which in turn try to neutralize the allergen. These antibodies bind to the allergen and trigger the release of histamine and other chemicals which cause symptoms of allergic reaction. So, as a result of this antigen antibody reaction, the body produce substances like histamine and other chemicals which cause the symptoms of allergic reaction. So, this is ultimately due to food protein, so called allergen, right? When the allergen enters into the body in turn produce antibodies. Antibodies react with antigen and makes the production of chemicals such as histamine, which in turn open up several symptoms. Several symptoms. What are all the causes of the food poisoning? Its exact reason is still unknown, but they are thought to be caused by a combination of genetic and environmental factors. So, apart from microorganism, there are other factors such as genetic factors and environmental factors are also playing a major role. And when exposure to the allergen, even in small amount, can trigger allergic reaction. Not we cannot tell it is a particular amount of allergen load is required by the body to exhibit the allergic symptoms, not like that. Even a small amount of allergen can also able to trigger the allergic response in the host system, right? So, we should remember. And what are all the common food allergens? Here I have enlisted a few allergens. Let's understand this. Milk, egg, peanuts, even tree nuts, soy, wheat, fish, and shellfish are found to be the key food allergens. To some people, food substances derived from marine origin are still allergic in nature, right? After having a healthy meal with marine derived food materials, show some allergic reaction around the mouth. In such cases, it should be immediately reported to the physician, right? Unless or otherwise, it may lead to fatal effects such as cardiac arrest, right? So, we should treat food allergy very cautiously. What are all the symptoms? Following are the symptoms such as hives, eczema, swelling of the face, lips, tongue or throat, even difficulty in breathing, wheezing is found to be the symptom of food poisoning, coughing, vomiting, diarrhea, dizziness. Even in some cases, this is noted called anaphylactic reaction, anaphylaxis, right? This is also noted in some cases. So, apart from anaphylaxis, above are very crucial symptoms, right? So, whenever a patient is experiencing food poisoning, he or she may develop the following symptoms such as wheezing, difficulty in breathing, vomiting, diarrhea, like that, right? Let's move on to the next slide. Anaphylaxis is a severe life threatening allergic reaction. Note this point very clearly, right? It is a life threatening allergic reaction that can occur within minutes of exposure, right? In some patient it develops very immediately, in some patient it may take some time, even hours to develop. And following are the symptoms such as difficulty in breathing, wheezing, hives, swelling, dizziness, fainting. Some patients may feel fainted, rapid pulse, low blood pressure. So these conditions, when a person, a person who is experiencing any of these symptoms after having a contaminated food substance, right, he or she is recommended to go and consult a physician immediately, right, to prevent uh, fatal effects or fatal damage to the life. Treatments. Here are some treatments such as antihistamines can help to relieve the symptoms of mild to moderate allergic reactions. Antihistamines are advised. Epinephrine. Epinephrine is an injectable medication that is used to treat severe allergic reactions. This is also recommended. Even sometimes OIT, oral immunotherapy, is a type of treatment that involves gradually increasing the amount of allergen that a person eats. This can help to desensitize the person to the allergen and reduce the severity of their allergic reaction. So, these are all the available medications, right, recommended by a physician. Is there any preventive measures? Yes, of course. We can eat, right, the food after reading the labels carefully. So, we should check the expiry date on the packed food material and ask about the ingredients when eating out. We should check or we should have a look on the composition of the food substance. Even the food substance may contain chemical ingredients which are found to be allergic to the human body, right? Be prepared to avoid allergen when traveling. So, extra care should be taken. Carry an epinephrine auto injector, because here I wish to share a experience of our own. Once we traveled to Bangalore for industrial trip in the year 2017, we were totally myself along with my colleagues and 47 students were infected by the food poisoning, because we were not aware of having food from the uh, roadside hotels. It was happened in a metropolitan city, Bangalore. Luckily, we were saved due to the prompt advice given by a physician based in Bangalore itself. He gave the right advice and right medication for us to reach our native in a safe way. So, we should be very careful while eating other food stuff, right? Eating food stuff or enjoying food stuff is usually a great experience, but before having a different food we should be aware of the ingredients, and we should check the health status of our own, and even we should check the hygienic background of the food material, from where it is being prepared or by whom it is being prepared, like that. So, we should be aware of all these things to safeguard ourselves from the fatal effects caused by food poisoning. Hope you are very clear about the concepts in food poisoning, effects of food poisoning, control measures, treatment facilities available for food poisoning. In case of any queries, you are most welcome to post your queries in the form of comments. I am available to answer. Thanks for watching. Stay tuned. Bye bye.